Dr. Mona, welcome. Good to have you with us.
It's great to be here with you.
So, after reading this book, I have to tell you that I found it very powerful, uh, disturbing, outrageous, just angering, because it is the ultimate story of government trying to save a buck and hurting people. And the people that get hurt most are the underserved and people of color. It's just, and it's still going on.
It's still going on, but yeah, the story of Flint is a roller coaster of emotions. And I absolutely felt all of those things as well in the middle of it and even to this day.
So as we talk about this, let's first talk about you and where you came from. How did you end up in Flint, Michigan? Because your family is actually from Iraq.
Yeah, I was not supposed to be in this country. Like that wasn't part of my parents' master plan. I was born in the UK. I was born in England, but also kind of by accident. My father was getting his PhD there. He was on a government scholarship. Our home country Iraq was paying for that, and he had a job lined up at like a nuclear plant. When he was done. And my brother, who's just a year older than me, was born in Baghdad, and that's where all our family was. And then my father finished his PhD, and it was the late 1970s, and I was born, and Saddam Hussein's kind of reign of terror was beginning. And my parents realized we can't go back home. Like they had loved ones and friends who had gone missing and who were silenced. And, they're like, we can't raise two small children, in Iraq. And they came to the United States with the beginning of a really kind of growing diaspora of Iraqi Americans. And so they were, leaving somewhere bad and hoping for something better, which is like the story of most immigrants, right? Like we all come to this country for that aspirational American dream and, fleeing oppression and violence and tyranny. And we came here for opportunity and for freedom and for democracy. And fortunately, kind of for my family and myself, that was realized. And that immigrant perspective, I think is how I ended up in Flint doing this work. I mean, it is what has pushed me to service. It's almost given me like this heightened antenna for injustice because, growing up as an immigrant, I was acutely aware of kind of like what bad people in power can do to vulnerable populations. And my parents instilled in me that, no matter where you are or what you're doing, you have a job to serve, to give back. And that's, I think, what it means. I mean, at least partly to me, to be an immigrant and why the contributions of immigrants are so valuable.
So how did you end up in Flint?
So we came to the Upper Peninsula of Michigan. I'm not sure how familiar you are with Michigan. So Michigan has a Lower Peninsula and an Upper Peninsula. And I know you can't see everybody, but I'm holding up my hands because in Michigan, we talk with our hands. And my father did a postdoc training in the Upper Peninsula of Michigan, which is actually 12 hours away from the Lower Peninsula of Michigan. So it would have been like easier to like commute from like Detroit to like Washington, D.C. So we ended up in Michigan where he trained. And then after a few years came to downstate Michigan where he worked for General Motors as an engineer. So everybody in Michigan also has an auto industry connection. And that is where we settled. But that's where most Arab Americans in this country have settled. So in Michigan, the most common second language is Arabic. So there's been, generations of Arab Americans, starting with those who came to work for Henry Ford, but really generations have settled in the Michigan area and predominantly in the Metro Detroit area.
And then you ended up in Flint as a pediatrician working. Is it Hurley Hospital? Is that what it's called?
Yeah. So our hospital is Hurley Children's Hospital. Yep.
Okay, so let's go to 2014, and there was a decision made to change up the water supply there. So tell me about that.
Yeah, Enrique, that's a great question. And I'm going to actually rewind a little bit more to 2011. So in 2011, something crazy happened in Michigan, and in Flint got taken over by state appointed emergency managers. So as much as Flint is a story of like government failure and science and public health and all these different things, Flint's also very much a story of what happens when we take away democracy, when, democracy is usurped, especially in majority minority communities.
And that was happening throughout the state. It just wasn't Flint.
Yeah, you're right. It was happening throughout the state. And at one point in the entire state of Michigan, half of our African-American population was under emergency management compared to just 2% of our white population. And if we rewind even a little more, this emergency management law was voted down by the people of Michigan. There was a statewide ballot, and the people of Michigan said, we don't want emergency managers. But our legislature in Michigan happens to be one of the most gerrymandered in the country. They tweaked it, they pushed it through, and it was signed by the governor, and it was done against the will of the people. And there was these little mini dictators in lots of cities where it was majority minority communities.
Was Snyder the governor at that point also?
Yes.
Okay.
So we have this kind of style of government going on where basically you have a weak mayor who's managed. And again, it goes back to that issue of kind of a bean counter, making a decision here, along with state government, the guy at the top. So tell us about that and how this then leads to the water being changed.
So everything was really driven by austerity. It was just driven by how can we save dollars? Should we sell the hospital? Should we, get rid of these pensions? Should we break contracts? Like everything was about saving money, saving money. And the emergency manager decided with the state that to save money, they would change our water source. So for half a century, the city of Flint was getting their water from the Great Lakes. And I think this is one of the greatest ironies of our story as well, is Michigan and Flint are surrounded by the largest source of fresh water in the world. 21% of the fresh water in the world is in the Great Lakes. And for half a century, we were getting our water from the Great Lakes, like high quality water. It was already treated by the city of Detroit, and it was just kind of sent up to Flint. And the folks in charge said, hey, this is now too expensive for this predominantly minority near bankrupt city. So we're going to save a buck and we're going to change our water source to the local Flint River until a new pipeline is to be built to the Great Lakes. So that's
how much did they end up actually saving?
Oh, man, that's such a good question because this breaks my heart. So the treatment that wasn't added to the water, the whole kind of disaster happened because the Flint River water wasn't treated properly with this ingredient called corrosion control. And it only would have cost $80 to $100 a day for the whole city to treat the water properly. I don't remember exactly how much they were anticipated to save, maybe in a couple, in the millions, but the cost so far has exceeded $1 billion.
Wow. So we should note that, Flint was having financial issues.
Yeah.
And with the downturn, obviously, in the auto industry and other things happening there. So, Flint was having some issues, but making this decision, had they any knowledge whatsoever of what was in the water when they made the switch?
Yeah, that's a great question. And I don't know what they were thinking. Like, first of all, like who goes from like a really high quality water source to a lower quality water source? And then second, why don't you treat it properly? Like, you have this not as good water source, but you're still supposed to treat it properly. And that wasn't done. So the hardest thing about writing my book and sharing the story is that so many questions are still unanswered. Like so many investigations are ongoing and efforts at accountability to figure out like, why did this happen? Like, was it really about austerity? Like what, like, why did this happen and why did it go on for so long?
Right.
What was the racial component of this? I mean, do they just disregard the community and say that they're less than?
Yes.
Right.
Yeah. So in my head and in so many folks had, the answer to that why goes back to racism. And that's been called out in many investigations so far. For example, the Michigan Civil Rights Commission clearly said that this was an egregious case of environmental injustice where the race and the demographics of the population played a role. I'll share a couple other statements that have come up in FOIA emails, like emails that have come out. Somebody at the EPA said, Flint's not a city worth going out on a limb for. Like, why not? And then when the EPA was trying to get the state to treat the water properly, someone at the state said, but who's drinking this water anyways? Like, not you, not your children, not people who look like you. And this indifference, this kind of blindness almost to this population is the reason that my book's titled What the Eyes Don't See, because, this was about a city that, people not only closed their eyes to, but they looked the other way. And it speaks so much to our kind of larger indifference to so many other vulnerable communities out there that we just choose not to see.
So okay, I kind of want to get the scope of it. It's like, what does lead poisoning do to young bodies?
Oh, thank you for asking. So as the pediatrician scientist, I would love to tell you. And this is how I got involved in the story. When I heard about the possibility of lead being in the water, that is when my life changed, because I respect the science of what lead does. Lead is a poison. It has no safe level. It is a neurotoxin, which means it attacks the developing nervous system, especially. It impacts cognition. So it actually drops IQ levels. It impacts behavior. It leads to developmental problems, attention problems, focusing problems, school outcomes, growth problems, hearing problems. Kids exposed to lead as adults and seniors can have things like high blood pressure and kidney disease and gout and dementia. So there's not been any level of lead that has been found to be okay. There's none. So now and that's because of amazing science, especially over the last few decades, that has taught us that levels we thought were okay decades ago, when really industry manipulated and forced its use in so many industrial products, we now know are not okay. And the reason I also freaked out when I heard about lead is because I already know that lead is a form of environmental racism. Well, 30 years ago, when I was an environmental studies student, we learned that lead is a form of environmental racism, because Flint kids already had higher lead levels, just like kids in Detroit and Chicago and Philadelphia and Baltimore, because of all these other systemic inequity issues that have disinvested in their communities, that have made it hard for kids to grow up to be healthy, because of all these other kind of, things that poison their trajectory.
What is the racial makeup in Flint?
Yeah, it's 60% African-American and pretty much 40% Caucasian.
Now, one of the things that you had been doing, you had been telling people that the water was okay as a pediatrician when people would ask you about it. And as I understand it, you really didn't know about the fact that this was an issue until one of your close friends at a barbecue at your house started telling you about this. And suddenly, you started to listen to what she said and started to investigate.
Yeah, that's true. So for about over a year, as a pediatrician in Flint, my patients would come to me with concerns about the water, like color and odor and taste and skin rashes, and, asking for that reassurance, like, is the water safe? And going through my head was like, yeah, like, how can our water not be safe? Like, we are in America, right? We're not in a third world country. Like, we have laws and regulations, and there's people who wake up that our tax dollars support that make sure that our water is safe. And then I would also think in my head, like, we're in the Great Lakes, like, we're surrounded by water. And on top of all that, like, the people in charge, like the officials in charge, would continuously reassure everybody that the water was safe. Like even after like a boil advisory, or people were complaining about color, or even after General Motors changed the water in their plant because they noticed their engine parts were corroding. So General Motors was allowed to go back to Great Lakes water. And even after that, the people of Flint were reassured that everything was okay.
Boy, if that doesn't tell you something, that you get, it's eating up an engine. Just imagine what it does to a human.
Yeah.
But the destruction had happened, right? I mean, they couldn't switch back to the water and correct it because the lead was leaching in the pipes at that point, right?
Well, we were told it was impossible to go back. We were told that a piece of the pipeline was sold and it was impossible to go back to Great Lakes water. So that was part of the argument. The Flint City Council during this time voted, said, hey, we want to go back to Great Lakes water. And the emergency manager was like, you can't do that. I'm in charge. Like it's impossible to go back. So there was many reasons given why we couldn't go back to Great Lakes water. But yes, for 18 months, we were on this super corrosive water. It was about 20 times more corrosive than the water that we had been getting from the Great Lakes. And that corrosive water ate up our pipes. It ate up the lead that was in our service lines, which are the pipes that go to the people's houses, and also the lead that was inside their homes.
So you started to investigate this on your own after hearing from your friend. And tell me about that and how you ended up looking at blood samples.
Yeah, so this is a story of high school girlfriends who got together. We were, just random last minute barbecue. We were both really moved by environmental activism, and in high school, she went on to be a drinking water expert, and I went on to do environmental health and eventually medicine. So she's the one that shared with me the possibility of lead in the water at my house with children running around. We have a glass of wine in our hands. So hang out with friends. That's the moral of the story. Hang out with friends who are different than you. And she shared that there was a possibility of lead because she had seen some memo released from a friend that said the water wasn't being treated properly. And that changed my life. That absolutely changed my life because I heard the word lead and I knew that science of what lead does. And that kind of set me forth on a quest almost to find out what was happening to our children. Was lead getting into our children? And that's the research that I did. Now,
after you were able to determine that there was lead in the blood of the children, you then had a press conference. You didn't follow what I guess would be standard operating procedure in these cases. So tell me about that, because that actually put you in a position of people questioning you as not only a scientist and a doctor, but, as a whistleblower.
Yeah. I've gotten so many humbling accolades during the last few years because of my work in Flint. And I think my favorite recognition that I have received is a disobedience award from MIT.
You're a bad doctor.
Bad academic.
Dr. Mona.
Yeah, bad. So that was really hard to explain to my children when I came home that I got a disobedience award. Like, why do I have to do my homework? But it was about doing what doctors and academics don't usually do. When we do research, we share it through this time-tested process called the peer review process. It gets published in journals and gets presented at conferences, but that takes a really long time, months, sometimes years to go through that process. And our kids in Flint didn't have another day. So I literally walked out of my clinic with my white coat on, and I stood up at a press conference, which is not something doctors do. And I shared the research and I demanded that, we alert the public and that we go back to Great Lakes water.
Now, what was the fallout from that toward you?
Oh, well, I felt great for like a half an hour. I'm like, hey, I'm doing my job as a pediatrician, which is being an advocate. I'm sharing science. And I who can question science? I'm just sharing facts. How could
oh no, nobody questions science these days. Yes.
Yeah, how could just facts? This went up, and here's my graph, and here's my p-values. So yeah, I felt great for a half an hour, but then the state and almost every arm of the state went after me, saying I was wrong and calling me all kinds of names, attacking my science and my reputation. So I felt this big. I felt tiny. I felt defeated. I began to second guess myself. I mean, like I'm like, you can't tell from, listening, but like I'm barely 5 foot tall. Like I'm a small brown immigrant woman going against these really powerful forces. And it was hard.
Did you think your career might be over?
Yeah, I thought my career was over. I thought the reputation of my hospital and the university was at risk, my family reputation. So I talk in the book about this concept in Arabic called ab. Ab means like you have created like shame on your family. And it was like the greatest ab that I had done this and could have potentially been wrong.
So then what happened? How did you manage to, how did things evolve so that the truth came out, that you were right?
So, I felt defeated and tiny for a little bit. But then I quickly realized that this had nothing to do with me. Like these attacks against me and my research, it wasn't about me. It was about kids. And my numbers and my research were not just like a number, it was a child. And it was this grounding in my why, which is children, that enabled me to get up and to fight back with more science, more data, more evidence. And we pushed back and told, shared why we were right and they were wrong. And it took a while, but finally it was our science. It was our persistence. It was our teamwork that eventually, got the state to concede. They conceded that, my data was right. My research was right. It was actually consistent with their data. And that put us on a path towards recovery.
Now,
so what was the pivotal moment when that flipped, when that changed? Because that's a lot of political force on you.
Right.
And at some point when they conceded, something must have changed. Something happened.
So I often like to say it was our science that spoke truth to power, and partly, but it was also media. It was journalists. We were starting to become an international embarrassment. When that doctor spoke and shared evidence that kids were in harm's way, finally, media, national media, international media started to pay attention. So I also credit the role of journalists with helping kind of really put a huge spotlight on this issue that got the state to kind of relook at their numbers and eventually stop fighting people, but kind of evaluating what was going on and concede.
What happened to the governor in this case? Let's talk about the political fallout from this.
So
he was a Republican governor, right?
He was a Republican governor, but really swayed by like our Tea Party legislature. Our legislature really pushed him, I think, to the right.
Yeah. What's his name again? I'm sorry.
Rick Snyder, former Governor Rick Snyder. Before the water crisis, he had presidential aspirations. Like his name was on different kinds of lists, but this ruined him. He didn't run again, obviously. And criminal charges were just recently filed against him, including misdemeanor charges related to the water crisis. So, this is his legacy.
Right. And it's not just him, because there were criminal charges brought against him before, as I understand it, him and also, I believe, a couple of the people in his cabinet that were health officials. Then they were dropped, then they were brought again. So now he's on the hook. I think he did try to fight it to try to get the charges dropped, but he's still facing that. So this is still ongoing. Are there others also on the hook here?
Yeah, lots of this is why there's no the end yet. So lots of ongoing investigations. I think over a dozen criminal charges. So a lot that isn't completely resolved. And I never used to think much of kind of these efforts at accountability and justice, like as a doctor. Like I would always it's deflect those questions. I'm like, oh, ask the lawyers and ask somebody else about like who should go to jail and all this. But increasingly, I've come to understand as a physician, like how important the concept of restorative justice can be to a traumatized and victimized community, and how without justice, it's hard to heal and it's hard to have closure.
So what going forward, there's obviously governmental burdens and all this, but what do the kids face moving forward in their community? What's the burden on their family? What's the burden on the community because of all this?
And their health going forward.
Yeah. What's their life going to look like?
Yeah, well, that's my job every day, is making sure that the kids of Flint and beyond Flint, can recover and thrive. So, we talked a lot about the lead. We also had a Legionnaire's outbreak, and older folks got pneumonia and died from this, which is why some of the criminal charges include homicide charges. We had massive skin issues, but really it was a population level trauma. The trauma of betrayal and lost trust and fear and anxiety and guilt and anger. Remember all that roller coaster of emotions. The people of Flint feel that every single day and have been feeling that. And just those emotions, just being part of that trauma of governmental betrayal can also lead to poor outcomes. So from the onset, we have been leaning on the science of trauma, of adversity, of kind of child development and lead exposure, and holistically have been trying to put into place interventions to mitigate the impact of the crisis. So, for example, we have brand new childcare centers and 24-hour mental health support and nutrition programs and literacy efforts and all of these different things based on science to support children and families so that we do not see the consequences of the water crisis. And one of the biggest interventions we have is called the Flint Registry. It's modeled after the World Trade Center Registry, which kind of follows folks and gets them help. And we've been able to we're trying to identify folks that were exposed to the crisis, and more importantly, get them connected to things like doctor and developmental supports and food programs and different things to see how they will do long-term. So this is long-term work, and our goal is that we can continue to follow folks, but more importantly, support them long-term. And I just want to add, that's what we're doing in Flint, but my story, this story, me being with you is not about Flint. But it is kind of about Flint, but it's about Flint everywhere. Right. How there's kids all over the place that wake up to some of the same kinds of situations as Flint kids, and how we need to all kind of open our eyes to these issues and do better on behalf of our kids.
Yeah, you've said this is an everywhere story, not just a Flint story.
Absolutely.
On top of this, now we're coming out of the pandemic. How is Flint? Well, we know a lot about how Michigan has dealt with the pandemic and the challenges there, but how has the pandemic impacted your work?
Yeah. So if you've read my book, or hopefully after kind of chatting with me, you'll quickly realize I'm this optimist. I'm an eternal optimist and a silver linings kind of person. And, the pandemic, on the heels of the water crisis, kind of helped us get prepared. The water crisis was almost a dress rehearsal for the pandemic, because we were able to build this public health infrastructure, this collaborative community-based effort, these resources that can help support families. So our water stations that handed out water became testing stations and now vaccine stations. And we already had connections with the United Way and the mental health agencies. So, one of the lessons of these kind of two crises is how important it is to be preventative and proactive and to work, to build this infrastructure to support folks. There's been people who've read my book recently who've shared, oh my gosh, did you know there was going to be a pandemic when you wrote this book? And no, but the lessons are so similar. It's about good governance. It's about respecting science. It's about being proactive and keeping people healthy. And it's about inequities and who's impacted by what. And these are the same lessons of the pandemic. And
yeah, but it's also about building trust with the community.
It is absolutely about building trust and restoring trust, how you go about restoring trust. So, just what we talked about in terms of the efforts at accountability and justice, in terms of what we're doing in Flint, it's taking a long time, but it's also a bit unprecedented to have a former governor be charged with something and to have a settlement in civil cases. And maybe that can be a model for the rest of the nation, where other communities have been suffering from other injustices and inequities, where we do need to talk about things like reparations and resources to mitigate those longstanding injustices. So these are all ways that we rebuild trust, and definitely the things that we learned in Flint, I think can, on top of the pandemic, can serve as a model.
So it's not just a social issue here. We're talking about an environmental issue that, not just, it obviously is affecting people of color in these types of communities, but it affects everybody. It really does. And you're seeing this elsewhere in the country, though. There's Newark, Pittsburgh, even Portland, Oregon.
Yeah, Portland, Oregon has lots of lead and water issues too. But yeah, it's all over. I think before Flint, a lot of folks are like, oh, we took care of lead. That was a yesterday problem. That was like a gasoline paint problem, but that was fixed. And one of the positive ripple effects of our work in Flint is that, it reminded folks is like, yeah, it was a yesterday problem, but it's a today problem and a tomorrow problem. And we have to deal with it. And, I'm seeing so many glimmers of hope. President Biden's infrastructure plan calls for the national removal of all lead pipes. That wouldn't have happened without Flint and our advocacy. No other community should go through what we had to go through in Flint. So that's one of the ripple effects. But once again, it's not just about lead, and it's not just about lead and water, but it's about, lots of other toxicities, childhood poverty, access to nutrition, safe schools, healthcare. All of these things are key ingredients. Our kids need to be healthy. Kids in Flint didn't have these things, and then so many kids don't have these things, and that's poisoning their potential. And we can do better. And in Flint, when our crisis happened, we turned it over into an opportunity. Like, how can we reimagine and do better on behalf of kids? And I'm hopeful that in this kind of national moment of crisis that we're in, we can take a step back and reimagine, like, normal wasn't working for a lot of people. Like, how can we, lead with public health at the forefront? How can we respect science? How can we work to build public health infrastructure? And how can we drive our decisions based on eliminating inequities?
Right. Dr. Mona Hanna-Attisha, thank you so much. You are just one powerful, energetic person. You kind of make me want to run through a wall or something. There you go. Well, I got to ask you this. Should we not drink water out of a tap?
Well, I think it depends. I think, if you have a vulnerable person in your home, like a pregnant mom or a baby, especially on formula mixed with the water, you should consider a filter. There's great filters you could put at the end of your tap. There's also other things you can do, like running your water, like turning it on in the morning after it hasn't been used until it's super cold. Cleaning out the aerator, which is like this thing that's screwed at the end of your faucet, that should be cleaned every few months. So there's things that we can do to reduce our risk. But we should be more cautious with vulnerable populations. And but we should demand stronger regulations. We should not rely on things like bottled water. All that does is make bottled water companies really rich, and they have gotten really rich after Flint. We need better policies to make sure that no matter where you live, you could turn on your tap and ensure safe drinking water. And we can do that. We can get there, but we need everybody to be engaged and to demand that.
All right. The book is called What the Eyes Don't See, a story of crisis, resistance, and hope in an American city. Please read this book. It is just really powerful. It'll piss you off, but you need to read it because it is important, especially in these times. Thanks again, Dr. Mona. You're great.
Thank you.